Increased intracranial pressure progresses through 4 stages. Think of it as the brain slowly losing its ability to compensate for increasing pressure. Stage 1 is full compensation. The brain senses the increased volume and compensates by shifting cerebrospinal fluid and reducing cerebral blood volume. ICP may still appear normal, and symptoms can be very subtle. Watch closely for small changes in level of consciousness, such as restlessness or confusion. Stage 2 is decreasing compensation. The brain is running out of room. ICP begins to rise, and neurological changes become more noticeable. The patient may develop worsening confusion, headache, vomiting, pupil changes, or increasing drowsiness. Stage 3 is failing compensation. ICP is now significantly elevated, cerebral perfusion decreases, and brain ischemia develops. A late warning sign is Cushing's triad: increasing systolic blood pressure with widening pulse pressure, bradycardia, and irregular respirations. This indicates a neurological emergency. Stage 4 is herniation. Pressure becomes so severe that brain tissue is pushed from its normal position. The patient may develop fixed and dilated pupils, loss of brainstem reflexes, abnormal posturing, coma, and respiratory arrest. Without immediate intervention, herniation can be fatal. The key concept is simple. Compensation fails, ICP rises rapidly, cerebral perfusion falls, ischemia develops, herniation can occur. For nursing care and your exams, remember, a change in level of consciousness is often the earliest warning sign. Do not wait for Cushing's triad. It is a late and dangerous finding.